Have you noticed the more normal medical cannabis gets, the more aggressive some of the headlines seem to get as well? That is something I keep on noticing. The second medical cannabis starts being discussed as an actual medicine or as a safer option for some adults, suddenly the same old fear stories come back. It causes dementia. It has no real medical use. It's a gateway drug. It ruins lives. It's all fake, and it's all just an excuse to get high. And honestly, I think a lot of people are tired of hearing the same recycled myths over and over. Because when you actually slow down and look at the evidence, a lot of these scary claims do not hold up the same way people pretend they do. And that's what makes it even more interesting, is the timing right now. In Canada, official data shows legal cannabis sales are rising while alcohol sales declining. So when cannabis is growing, becoming more normal and becoming more accepted, it is fair to at least ask why it still gets treated like the villain in so many different stories. Now, to be clear, I am not saying cannabis is perfect. I'm not saying it's for everyone, and I'm not saying there are no risks. What I am saying is the conversation around medical cannabis is still too dishonest. So in this video I want to go through some of the biggest negative myths the media keeps on pushing and compare them to what the evidence actually says. Myth number 1. Cannabis causes dementia or serious cognitive decline. This is one of the biggest scare lines. You have probably seen it before, the way some headlines talk. You would think using medical cannabis means your brain is guaranteed to decline and dementia is basically waiting for you later in life. Oxford Population Health reported that a large study found no evidence that cannabis use in older adults was linked to faster cognitive decline, and no evidence that it actually increased dementia risk. And that matters, because this is exactly what keeps on happening with the cannabis in the news media. A concern becomes a certainty, a question becomes a headline becomes a fact. People repeat without ever reading the actual studies. Now, Oxford did not say that cannabis is magically good for your brain. They did say that there are risks. They simply said this common claim that cannabis use in older people clearly causes cognitive decline and dementia was not supported by their findings. That is a huge difference. Because saying this is worth studying is not the same as saying this is proven. And with cannabis, that jump happens all the time. Myth number 2. Cannabis has no medical use at all. This one should have died years ago, but people still say it. They talk like the whole idea of medical cannabis is fake, like it's just a loophole, like there's no legitimate medical usage at all. But this is not true. NHS says cannabis-based medicine can be prescribed on the NHS by a specialist hospital doctor or under a specialist supervision, and only for a small number of patients. It says a specialist might consider it for rare severe forms of epilepsy, MS spasticity and chemotherapy related sickness when other treatments still have not helped or were not suitable. NICE has also formal guidance on cannabis-based medicinal products, including prescribing for intractable nausea and vomiting, chronic pain, spasticity and severe treatment-resistant epilepsy. So, let's be honest here. You can argue about access. You can argue about how strict the system is. You can argue that doctors should prescribe it more or even less. But you cannot honestly say that cannabis has no medical use when the NHS and NICE already treat cannabis-based medicines as a real medical category. And I think this is a part of why people get frustrated. Because so many patients are still made to feel like they are doing something dodgy, when they really are talking about a legitimate treatment area that already exists inside the healthcare system. That does not mean access is easy. It does not mean that the system is perfect. But it does mean the old no medical value is, well, outdated, invalidated, all of it. Myth number 3. Cannabis is a gateway drug that pushes people onto harder drugs. This one has been repeated for decades, and because it has been repeated for so long, people just assume it might be just proven by now. And because it has repeated for so long, a lot of people assume it must be proven by now. But when you actually look at the evidence reviews, the story is a lot less dramatic. The US National Institute of Justice reviewed the gateway hypothesis and said the research has produced mixed results, in that no causal link between cannabis use and the use of other illicit drugs can be claimed at this time. Public Health Ontario says the gateway hypothesis overall has not been proven, and there is no conclusive evidence that cannabis use casually leads to the other use of other substances. And this is the key point right here. Association is not causation. Just because two things show up together does not mean one caused the other. That is basic logic, but somehow when cannabis is in the topic, people forget it. Real life is messy. People have different home lives, different traumas, different friend groups, different mental health struggles, different environments. So when the media says cannabis is the gateway, it makes it sound simple and inevitable. But the evidence is not that simple. There may be patterns, there may be even associations, there may be risks with earlier or even heavier use. But the neat little story that cannabis has been conclusively proven to send people straight to hard drugs is just not backed up by the way people claim. Myth number 4. Medical cannabis is just a legal excuse to get high. This is one of the most dismissive myths, and honestly one of the most insulting too, to be quite frank. Because it basically tells patients their treatment is not real, that their condition is not real, and the whole thing is just a performance. But again, that framing falls apart once you look at how medical cannabis is actually handled. The NHS says it can only be prescribed by a special hospital doctor or under specialist supervision, and only for a small number of patients. The NHS also makes a clear distinction between prescription cannabis medicines and shop-bought CBD or hemp products, saying those retail products are not guaranteed to be good quality or even provide health benefits. That matters because people love to blur anything together. Street cannabis, prescription cannabis medicines, CBD oils, internet products, everything gets thrown into one pile. And once that happens, the discussion becomes lazy. Medical cannabis is not the same as random products bought online. It is not the same as every person using cannabis socially. And it is definitely not fair to reduce every patient to just trying to get high. This is not serious thinking. This is stigma dressed up as common sense. So, why does this keep on happening? Honestly, I think because fear is easier to sell than nuance. Headlines saying cannabis causes dementia, or a headline saying cannabis causes dementia gets more attention than saying a large study found no evidence of increased risk in older adults. And a headline saying a gateway drug is easier to spread than the evidence does not prove a causal link. That is why these myths keep on surviving. Not because they are always strong, not because they are always current, but because they are simple, emotional and easy to repeat. And this is where the Canada point matters. when official numbers show cannabis sales rising while alcohol sales fall. It's not crazy to wonder whether the public conversation around cannabis becomes more heated as it becomes more normal, accepted and more competitive with older industries. That is still an inference, not proof of motive, but the broader trend is real. So, here is where I stand on it. Cannabis is not some evil monster the media has spent years trying to turn it into. That does not mean it is for everyone. That does not mean that there are no risks. That does not mean every claim made in favour of cannabis is automatically true. But it does mean that we need a more honest conversation. If Oxford says there is no evidence of faster cognitive decline or increased dementia risk in older adults, then people should stop speaking of it as if that is the outcome that is actually proven. If the NHS and NICE recognise cannabis-based medicines, then people should stop pretending that cannabis has no medical value at all. If major evidence reviews say that the gateway theory has not been proven and no causal link can be claimed, then people should stop using that line like it's a settled fact. That is really the point of this video. Not blind praise, not blind fear, just honesty. Because cannabis deserves to be discussed like every other serious topic, with evidence, with context, without the same tired myths being recycled forever. And maybe that is what really bothers people. The more the facts come out, the harder it is to keep the old story going. And on that note, thank you for watching. Peace.